All right, welcome. Thank you so much for joining us this afternoon. I'm Angela Birch-Achatry. I'm part of the early learning team at the Hunt Institute. And I want to thank you today for joining us today for this collaborative webinar with Data Quality Campaign, or DQC. This webinar came to be through what we've heard through our legislative learning community and our agency lead learning communities, who are our audience here today, over the past several months. And that is that data is something that is needed, but there's also questions, confusion, and a lot of room left for growth over for data. So right now, I want to hand it over to our Director of Early Learning, Kelly Epley, for a few welcoming comments as well, and we'll get started. Hi,
Thanks,
Kelly.
Angela. Appreciate your patience while I was getting myself signed in. Just wanted to say that we're really thrilled to co-convene this webinar with the Data Quality Campaign. We recognized this need through the goals that a lot of you made while you were at the 2024 Early Childhood Leadership Summit, and we hope that this provides a start or information that you might be looking for as you begin. I think Angela may have mentioned it, but I'm just going to reiterate that today's session will be recorded, and the recording will be shared with everyone who registered. And there will be a Q&A period later on. You're encouraged to use the Q&A function at the bottom of your Zoom screen to submit questions for the panelists to answer during that time. So if you go ahead and locate that now, in case you come up with questions you want to ask during the initial part of the webinar, you'll have that ready. And in a moment, you're going to hear from our guest moderator, Charlie Rosemond, who was instrumental in helping plan this webinar. Charlie is the advisor on early childhood at the Data Quality Campaign and has been working directly with the folks that we're going to hear from today. And I also wanted to welcome and provide an opportunity for some introductory remarks from Camila Camborda, who is the Data Quality Campaign's Associate Director of State Policy and Advocacy. Camila, we welcome you, and I'm going to turn it over to you.
Great, thank you, Kelly. Hello, everyone. My colleague Charlie is going to go ahead and share his screen. All right, wonderful. So to reiterate, thank you all for being here today. We are so excited to bring these panelists together for this important conversation that you all have shared an interest in. So thank you for that. My name is Camila Camborda. As Kelly mentioned, I am the Associate Director at DQC for State Policy and Advocacy. For those of you who may not yet be familiar with the Data Quality Campaign, we are a national, nonprofit, nonpartisan organization, and we are advocates. We advocate to change the role of data to ensure that data works for everyone who is navigating their education and workforce journeys. Charlie, you can go to the next slide. What that looks like is supporting all variety of stakeholders as they make informed decisions for the continuous improvement of school and student outcomes. We believe that states have the data within their integrated data systems, within their agencies that audiences could use to answer questions and make decisions. And so it's about how we essentially make data work for people. And if you notice, our logo has a little 20 on it. That is because this year we are celebrating our 20th anniversary as an organization. So we've been around for 2 decades, working at the state level, working at the federal level, all in the service of making sure that data works for people. Next slide, please. And we like to start really every presentation or really every conversation about data with this infographic here, because this really points to our why. And our why is Grace and her path to success. So this infographic shows Grace, a young woman, as she goes on her journey through education, including early education, K-12, and post-secondary, and the workforce. And as you can see throughout her journey, she has decision points that can lead her down different paths, ultimately choosing a path that leads her to a career in nursing. And the reason why we love this infographic and why we think it really resonates with a lot of people is because this is really the vision. When we say that data should work for people, we mean that everyone, including people like Grace and every other student in her classroom, has access to the information at key decision points so that they and the people who support them can make the right decision for them, regardless of what path they take, right? We know that paths, if ever they were linear, are not anymore. And so we really want folks to be empowered with the information to make the best decisions for them. Next slide, please. Like I mentioned, we are celebrating our 20th anniversary, so I wanted to give a little bit of overview of what we've been up to for the past 20 years. So when we launched in 2005, we were primarily focused on the K-12 space and worked with states as they developed these initial integrated data systems. Over time, as states developed their data systems and their data ecosystems and infrastructure, we began to focus on this question of, can people answer questions with the data? You know, it's there, but is it just sitting in a box somewhere, or is it useful and actionable for people? So a couple of years ago, we came together with 40 of our state and national partners and asked that question exactly. We said, we know that states have built up a lot of systems in order to have the data, right? But do people feel like they have access? And what we heard resoundingly from all variety of students and families and superintendents and principals was, no, we don't. And so we decided to revamp our vision and really center in on this idea that that it really should be about access to data. So Charlie, if you can go to the next slide, please. So this is really where DQC is today at our 20th year, really centered on this idea that everyone should have tailored access to the information that they need to drive student success, economic mobility, and systemic change. And more specifically, what that looks like is enabling successful transitions. So as we saw with Grace at those critical junctures where she needs information. And we think that the institutions and states at this point have that opportunity, that the time is really right to make that vision possible. Next slide, please. And just to illustrate, right, I really appreciate what Angela said at the beginning about folks were saying that data is needed, but there are questions, right? And that's something that we talk about all the time is that people have questions and that data can and should help answer those questions. Whether you are a first generation college student asking, am I on track to graduate, ready for college? Whether you are in the workforce and you have questions about upskilling and finding a new career, or whether you are in community college and looking to transfer to a four-year institution. So all of these and more are questions that people have that we believe data can and should help answer. So that is it for my spiel. I will turn it over to Charlie.
Perfect. Thank you so much, Camila, for taking the time and for introducing DQC in our work. And thanks all for joining today. So my name is Charlie Rosemond. I'm an advisor with the Data Quality Campaign. And I'll dive a bit here into our early childhood work, but I also have the pleasure of moderating today's panel. So with that, we will keep the ball rolling. So as Camila mentioned, DQC, we're in our 20th year, and really to date, a lot of the work is focused on K-12, slightly more recently, higher education in the workforce. But of course, the early childhood community has questions too. Unfortunately, across many states, it's been difficult over time to get answers from an early childhood data ecosystem that tends to be fragmented, disconnected, and under-resourced for myriad reasons that we could talk all day about. But it's just a really challenging space to really glean value in a timely and meaningful way for folks. So, for us at DQC, we saw this need, people deserve more value from the early childhood data ecosystem. And so over the past roughly 18 months or so, DQC has dived into early childhood, guided by two general questions. So the first, what's the broad value of better early childhood data? like better connected data, higher quality data, more accessible data. And number two, what's the value of growing connections between those better early childhood data and data from K-12, higher education in the workforce and elsewhere to create that broader preschool through workforce T20W plus spectrum. And what's that look like for us? So we, at the start of 2024, took about 10 months, convened an advisory committee of representatives from over 20 different national organizations, research orgs, policy orgs, membership organizations, really a broad swath of folks representing different facets of the early childhood community, brought them together, conducted dozens of interviews with committee members, but also folks in the field to arrive at 3 use cases, simple math, 3 use cases that are kind of the vehicle that DQC uses for its outreach in this space. And really, these use cases are meant to help answer the question, what could states do with better early childhood data? Because they are, really meant to be stories to tell, stories that the field, the community can tell about what's possible when we have better data. Because, as Camila mentioned, as advocates, that's really our goal at DQC, getting people thinking and talking about what's possible and asking questions and really gleaning value from the data. And so our 3 use cases ended up being, really representing families, providers, and also policymakers. So the first, making accessing services easier for families, reducing the reporting burden on providers, and then integrating data across services to inform policy decisions. So for each of these use cases, we created a story. We use avatars, examples of people trying to get access to better data, better information, but we also highlighted exemplary work from the field at the state level. And so today our panel, we have data leaders from each of our 3 states associated with these use cases, and we'll be diving into more. But with that, I will provide a bit of an overview into each use case. So starting with the first, states with better data, states can make accessing services easier for families. As I mentioned, each use case, we have an avatar. In this case, we have Elise. There's a grandmother searching for services for her granddaughter. And, it shouldn't surprise this group or really anyone, but, finding and accessing appropriate early childhood services can be pretty overwhelming for folks like Elise, but families generally. And so states have a lot of data. States are, awash in data, but how can they work to turn that data into more accessible and useful information for folks like Elise? And so public-facing family portals, centralized enrollment, coordinated intake, these public-facing data products are one way to do that. And so in this case, portals, they can help compile, integrate data on the back end, but compile useful information on quality of services, the availability of them, who isn't eligible, but also how can folks enroll in these services. And so our exemplar for our first use case was South Carolina, and specifically the First 5 SC portal. So First 5 SC is really meant as an online one-stop shop for finding services and also determining eligibility and applying for them. Over 40 different public services in the state of South Carolina. And so all of this work is built on a back-end integration of disparate data sourced from disparate data systems. And it took a lot of legwork in terms of just getting the right people in the room, hashing out kind of how we pull these data together and how can we create that more useful information for folks and deliver it in a way that is accessible and clear. So that is South Carolina, and we'll be hearing from Molly Tuck later about that great work. So our second use case, states with better data, states can reduce the reporting burden on providers. So I mentioned, a lot of data is out there, we have to remember the folks who are collecting those data on the ground and reporting them. And so data collection and reporting can be particularly burdensome for those frontline providers. In this case, our avatar was Allison, who is a childcare center director. So folks like Allison, they have a ton on their plates. They wear a lot of different hats, and one of them being collecting data and ultimately reporting data to the state. But just given this fragmented world of early childhood services, oftentimes, folks have to report data, sometimes on the same kids, but report data to multiple different state agencies, in accordance with different funding streams and administrators, and that just takes a lot of time. It raises the likelihood of like data entry error and other challenges, and it's just like not necessary. It's a real administrative burden. So, there are ways that states can provide supports through technology, systems alignment to help ease those administrative burdens and hopefully also raise data quality. And so our exemplar here is the state of Iowa that's done great work to subsidize childcare management software and provide other business supports to providers. That has really set the stage for collection and reporting more timely data to the state. And so in turn, those better data are informing the public-facing Iowa Childcare Connect platform, or Iowa C3, which provides to the public really essentially real-time, near real-time information on childcare vacancies across the state. So folks, looking back at a lease, folks who are looking for care have like the best information they can in terms of what care is available. So we'll be hearing from Heather Rouse from Iowa about that work later on. But last but not least, excuse me, our third, with better data, states can, inform policy decisions, integrating data across services. Folks need more comprehensive views of what's happening. Policymakers do, others do, like kind of systems decision makers. But, creating those views can be difficult for states for some of those reasons I named earlier, but it definitely is possible through more intentional and systematic integration of data across all of these disparate services, whether it's state-funded pre-K, childcare, Head Start, home visiting, the IDEA programs. There are all of these different services. And, folks in this case, Felipe, who's a state legislator, they need a view of the system, of the whole, to make those more systems level decisions. Never mind folks, who are perhaps interested in more specific services, they need information on those as well. So, how can states be more intentional about connecting data to create that more cohesive and comprehensive view? In our example here, it's Virginia, which has really been a real exemplar in its efforts to grow internal data capacity at the state level, pursue strategic partnerships with, public university, advocates, and others, and to build integrated data systems, like in this case, Link B5, and they continue to enhance their infrastructure as we speak. And we're fortunate to have Tierra West here today from the Virginia Department of Education, who will speak more to Virginia's work to date, but also their plans for the future. So you've heard from Camila and me, but as I mentioned, now on to the main attraction for today. So it's my pleasure to introduce the members of today's panel. As I mentioned, each of these folks are data leaders from our use case exemplar states. And just for my part at DQC, I am a data advocate. It's pretty niche work, but I'm so lucky to really interact with a lot of folks across the country that are doing really innovative things. And it's really exciting to see states that are taking the lead in this space And, our three panelists today are really exemplifying that. So in order, we have Molly Tuck. Molly is the Strategic Data Fellow for South Carolina First Steps. We have Heather Rouse. She is the Director of Iowa's Integrated Data System for Decision Making, I2D2. What a great acronym. And I2D2 is housed at Iowa State University. And here again, we have Tiara West, who is the Associate Director of Early Childhood Data Systems for the Virginia Department of Education. So again, I'm so appreciative of these leaders' broader work in this early childhood data space, their partnership with DQC on this resource, and they're taking the time to join today's panel. So with that, I appreciate your patience as we get set up here, but we will switch gears to our panel. As I'm doing that again, as Angela and Kelly mentioned, please avail yourselves of this Q&A feature. We will have time at the end of today's panel just to go through your questions, and yeah, that's really our hope, to provide useful insights for all of y'all. So with that, we will go ahead and get started. But my first question today, we will start with Molly. And so Molly, my question for you, how did South Carolina First Steps, your organization, approach building this First 5 SC portal? Like, how were the various stakeholders involved in this building process, and what disparate data needed to be integrated to create, this portal product?
Yeah, great question, Charlie. So I think we can all agree that the early childhood education ecosystem is pretty complex, especially when we consider the different funding sources. And a lot of the work that my organization does is focused around that funding. But when we think about parents of young children, as they're searching for programs or services throughout the state, they're not really interested. I mean, it doesn't matter who funds the program. They're just looking for, early childhood education opportunities, or if they're facing food insecurity, they're looking for WIC or SNAP. And so we really wanted to provide an opportunity for parents to easily navigate the system, regardless of sort of those funding streams. And a big key to that would be the data integration. And so thinking about stakeholders, which I know you mentioned, our number one stakeholder throughout all of this was going to be the parents and the families of young children. We wanted to, we had heard anecdotally from someone who worked at the organization that they had young children, and they were even finding challenges in navigating the system, and they worked in early ed. And so if they're facing challenges, we couldn't even imagine what sort of challenges our families were facing throughout the state. Plus, we had data sort of showing that this type of service would be useful in the state. Our First 5 South Carolina portals, actually an iteration of a previous initiative called Palmetto Pre-K, which was really focused on connecting families of 3- and 4-year-olds across the state with preschool programs, including Head Starts. And we just saw a lot of use of that portal, a lot of families telling us that this was a really important way for them to connect to programs. And so we decided, what if we expanded that, both in terms of the ages of children, so moving from, instead of just 3 and 4, from 0 to 5, as well as the different services for those age groups. And that's where this idea was sort of born from. Like I mentioned, families were really going to be the main stakeholder for us, but we also wanted to be cognizant of who would be participating in the First 5 portal. And so we're really fortunate in the state that we have a robust state warehouse for data. So a lot of our agencies were already pretty familiar and pretty comfortable with sharing data, but there were considerations around data privacy that we had to consider. And so when it came to, or when it, now in practice, one of the key components of this to really get programs on board is if someone is filling out an application and they qualify for WIC or for Head Start, the data is going directly to WIC or to Head Start, whoever they're qualifying for, rather than us keeping the data. And so we're more of just the facilitators of these applications based off eligibility to the programs. And I think that was a really important component in getting groups to agree to work together and come together to integrate the data in this portal. And we're also, I think, filling gaps in services. For instance, one of the data points that we really like to talk about is we're seeing that like 62% of use of this portal is happening outside of traditional office hours or traditional program hours. And so this is really providing opportunities for families when maybe their children are sleeping to be able to go on and find that information that just probably wouldn't be possible during the daytime. And so I think that that is just another way that we were able to really, again, prop up our parents and our families as our main stakeholders in this.
Absolutely, absolutely. Thank you. Yeah, and you voiced that prioritizing those families, those providers who are obviously experiencing these services in an immediate way. And I think for us at DQC, a lot of our work, we are focused on state level, systems and policy change, but also ensuring that that change is felt by folks locally. And so if states are investing in state level infrastructure, ensuring that those investments are felt, if people are really getting value from those better data that are making their way down from the state and to the public. So thank you, Molly. That's perfect. And yeah, now I want to shift to Heather in Iowa. And so Heather, what were the state of Iowa's original goals for just this work broadly, like investing in the data system, but specifically, the work we highlight, subsidizing software and providing business supports for providers, like how have providers responded to these supports and, what's been the impact on data quality?
Yeah, thanks, Charlie. So this work, I mean, I love following South Carolina. That's, what the system that you've built is something that really gets me excited and thinking about what some next steps could be. I've been working with the state of Iowa for almost 10 years now, and we built an ESIDS, an early childhood data system that was really more around, program and policy evaluation. I think a little bit about like what TR is going to talk about. But this interim space came up around 2021, 22, coming out of COVID, and our governor had a task force on the childcare crisis. Okay, you have childcare programs shutting down, you have families trying to figure out how they're going to find childcare. And so we were fortunate to be at the table with the Department of Health and Human Services as they were thinking about that. And really, similar to some of the things Molly was sharing, how do we help families get the care they need when they need it so that, so ideally parents can keep working. We can't not have children in childcare and not have parents working. And how do we help with that? And also, how do we support childcare businesses so they don't have to close their doors, so they're not, overwhelmed with paperwork, so that they can't actually do the care that they want to do because they're too busy working on the computer systems. And so this work really evolved, and ultimately we developed something called Childcare Connect. The task force recommendations came out and basically said, we need to help childcare businesses collect and manage data. We need to make it easier for them to collect attendance on families and to get reimbursed for subsidy, because that takes a lot of work for them. We want to reduce the reporting burden for them. We need to bring disparate data sources together. So just like Molly highlighted, in childcare even specifically, you've got license and registration, you've got your attendance data, you've got your subsidy reimbursement, you've got provider registries, you've got lots of different data systems. And if you ask at any given day, how many providers do we have in the state? Well, it depends which one you ask, right? So the state wanted a system that could really help us reconcile some of that and create public-facing dashboards and ways for communities to do community planning, for businesses to showcase when they have vacancies, and for families to know where to find care. So what we ended up, and we were fortunate again to be at the table to be able to capitalize on some ARPA dollars to stand up a new technology system. We partnered with a software firm that had expertise in building systems in real time like we have. And so now we have an operational data store that brings in data daily from all those different sources that I mentioned. We've created a data source, a way to collect, if providers have a vacancy, a child or family moved away and they have a vacancy, they can tell us right now, I got a vacancy in my infant classroom, ping, and it shoots over, and we're able to then translate that into a map or a dashboard that shows here's the data that's available in a certain area for strategic planning, or for a family that's searching for care that maybe just moved to your town. I need childcare for my infant and my preschooler. What's available? With respect to your question about changing data quality, what's been really neat to see is when you put something on a dashboard and you put something on a website, people look at it, right? And then all of a sudden, oh gosh, that isn't actually showing what my program is doing. So how can I make the data more accurate? I actually do have a vacancy for this infant classroom. I actually do, have opportunities for children, families that come in the area. So we've really seen providers lean in. When we first rolled this out in August of 2024, we probably got, 20 to 30 emails a day. The pin on the dashboard is red. I'm not red. I actually have openings. How can I fix this? And so it's really created an opportunity for a discussion around data culture with providers, and with the coaches and managers that work with them, to help providers make data more part of their daily routine without it consuming 90% of the air in the room. So, we now have, I'm roughly estimating, 60 to 70% of our providers giving us updated vacancy data every month. We're able to have conversations about what do vacancies mean? What does staff capacity mean? Because things are now more publicly visible, we have more conversations about definitions and data collection that's really improved the quality. And the dashboards are more, as I said, more visible. So folks are tuning into them. And that's been really kind of neat to see how that's evolved. And we're looking forward to what some next steps might be. So thank you for the question, Charlie.
And thank you for the response. Very thorough one. And like DQC, data quality is in our name, so it's explicit, I suppose, but I just cannot emphasize enough the need for folks to, like, we have all this data. Are we collecting them purposefully? Are we collecting them with fidelity to high quality? And ensuring, garbage out is pretty cliche at this point, but it's true. Like, the data we're collecting and reporting need to be of high quality, such that once we're integrating them, the pictures we're painting, we know that they're based on the best data we can come up with. So perfect. Thank you, Heather. And yeah, so Tiara, I mentioned Link B5 earlier. Would love to hear more from you. Like, what data are integrated in that system, and or its like sister systems in this broader ecosystem, and like how have VDE and its partners use these integrated data to support local communities across Virginia?
Yeah, so Link B5, I think this was noted in the brief, but Link B5 is the official data system for what we call our quality measurement and improvement system, but I think a lot of other states call it their QRIS. And part of the law that helped to unify early childhood under the Department of Education, it also tasked us with creating this unified measurement and improvement system, and it mandated the participation in VQB5, our quality measurement and improvement system, for any provider taking public funding. And so in Virginia, any provider who accepts any public funding and serves children between birth and age 5, they're required to be in Link B5. So they register every fall, and we collect data throughout the year. So this includes all the programs that receive any funds from the Virginia Preschool Initiative, from the Child Care Subsidy Program, Head Start or Early Head Start, our mixed delivery funding model. We have early childhood, special education, and IDEA funded programs in there, Title I, C Campus, military childcare fee assistance. We also have some local subsidies in Virginia, and so they are also required to participate. And then any privately funded program is able to opt in to Link B5 if they want to participate in VQB5 activities. So we do class observations and things like that. And we do have a small portion of sites who do, of private sites who do opt in. We've been really successful in getting to 100% participation. So we just wrapped up our second required year, and we got 100% participation the first 2 years, which we're really excited about. So we have about 3,700 family childcare homes, public schools, and childcare centers represented in Link B5 right now. Our plans moving forward to further integrate with other programs. We are launching a system that we have called VA Connects for Kids. We're calling it VA Connects for short. It's our nickname. And that system will actually integrate our assessments for early childhood, for kindergarten, and then our literacy assessment. So we have a kindergarten readiness assessment, and we have our literacy screener as well. That goes up to 8th grade. And so starting this fall, we'll launch in August, we will have a data system that connects birth through 8th grade. And we're really excited about that. And this system will bridge student, classroom, and site data for all of those students. So it'll be linked within a school year. And then also children will have longitudinal data as they grow up and mature through our education system. So for example, information about a child's infant, toddler, and preschool experiences, they'll be connected to their student ID, which lives with them through their K-12 career. So we'll have all that assessment data associated with their ID. And then once they get to high school, we'll continue to have that ID associated with their high school information. And then through our state's longitudinal data system, we'll also be able to connect to some of those adulthood, higher ed outcomes as well. So we're really excited about that opportunity. And we're really excited to kind of watch this happen over time. In terms of how we use this data, I think a really important piece of that is how we collect the data and the type of data that we collect. So we have found that the greatest variability in a child's experience happens within the classroom. So, 2 3-year-olds in the same school, but in 2 different classrooms can be having very different experiences. And so our hierarchical, or someone might call it a nested model, allows us to really start to tease that out and look at what the data is telling us. So we collect data on every site, every classroom, every administrator, every educator. And then within a classroom, we collect what students are in that classroom. And then we also do class assessments twice a year in the fall and the spring, and that is associated with the classroom and the teacher who was the primary teacher during that observation period. So we have a lot of data, and it is very interconnected. Some of the things that we collect are enrollment and vacancies, tuition rates, curriculum use, language of instruction. And then for educators, we collect pay rates, years of experience, education, things like that. And one of the things I think that's also unique about our system is that we continuously use our data, and we have this kind of cycle approach. So over the course of a year, our analysts are constantly verifying and cleaning the data as it's coming into us. And then we spend a ton of time conducting analyses. We bring a whole bunch of leaders together, and we literally sit in a room for 3 to 4 hours. I find it very fun as somebody who loves data. And we bring over 100 slides of data, and we literally just go through all these different topics, all these analyses. We do the long pauses, we force different leaders to kind of talk and respond and react and things like that. We come up with some policy impacts, some recommendations, some directives. We go out and we implement those. And then a few months later, we come back and we look at any associated data, and we do that whole thing all over again. So we recrunch the numbers, we come back together, we talk about it, we tweak what we need to, and rinse and repeat. So we do this several times throughout the year on several different topics. And then we also do this annually with every single region of the state, where we invite providers and school divisions and various leaders at that regional level. And we do the same exercise with them as well. We do this with legislators, with superintendents, we do it with our governor's office. So really any group that would benefit from this kind of exercise of using the data and discussing it, we target them, and we encourage the field and our partners and other stakeholders to copy this and to do this as well. And so a couple of examples, we have our public quality ratings for For VQB5 online, we have been able to target PD supports for educators in the field and give feedback to those educators in an individualized way. We've been able to help legislators understand the landscape and understand what's happening in specific counties in the state, and so much more. So thank you for that question, Charlie, and happy to see. Oh, I thought there was a question in the chat, but yeah, thank you all.
Yeah, thanks, Tiara. Like really appreciate it, and it's so exciting. Like as Tiara mentioned, like these connections, they're doing such great work in early childhood, but keeping in mind how it's a part of this like broader spectrum, connecting with early elementary through 8th grade, as she mentioned, you know, through high school, higher in the workforce to paint that broader picture. Because like ultimately policymakers are trying to assess like the effects of XYZ policy interventions. Like you need that longitudinal data set to really tease out those effects and whether they're robust over time. And so this sort of infrastructure investments in this sort of infrastructure, that's how we get there. So yeah, next question and same question for each of you. I suppose we'll go back, Molly, Heather, Tiara. But what advice would you offer to a state that wants to support and sustain data work similar to, you know, what you've described today?
Yeah. So my advice would be to be really intentional about using data to tell the story of the impact of this sort of work. And so, for instance, with our first 5 South Carolina portal, it's almost deceptive, and it seems like a pretty straightforward portal. Families go on, they enter their information, they're told whether or not they're eligible for certain programs, but there's actually a lot of things that are happening behind the scenes. We have families learning about new services that maybe they didn't realize they were eligible for, or they didn't realize existed. We have families being able to choose between different options, not knowing that they had a choice previously. And then we also have, you know, the supported offers to our programs that are participating, because I'm going to go back to funding, as I mentioned at the beginning. A lot of funding is based off of usage of a service or about, you know, slots being filled, and so it's getting their message out there and providing that outreach opportunity as well. And so I think in order to really support this work, we had to be able to tell all of those different stories and show the value of the system to really move our General Assembly to understanding that, you know, this work had to be financially supported rather than just grant funded, which is how it really began. So I would say just be, you know, intentionally telling different aspects of the story through data.
Absolutely. Same question, Heather. So like, what's your advice for states supporting and sustaining?
Yeah. So with this system, we spent quite a bit of time in the beginning trying to envision all of the use cases for what it was going to be. And I think that taking time to do the visioning and missioning of the work is really important, even when you don't think you have time to do it, is an important thing, because you're going to invest a lot of time and money in this. I see another question in there about how do you do that? And if you build it once and then you get 18 months in and say, oh, wow, this is super cool. Can we do PQRTZ with it also? And you didn't have the forethought to put in some of them again, that's super costly. But if you can really think up front about, even if you're not going to do all the possible builds at once, which I think is the second piece of advice I would give, is vision big, build in phases. So vision big, meaning see if you can map out what you think you might use this for and cover your bases and figure out if there's decision points you need to make now, leaving the door open for possible things you might do later. You know, if you envision this out and there's 10 pieces to it and you say, okay, we only really have time and money for 2 pieces, but let's make sure we have an infrastructure in place so that we can do pieces 3, 4, and 5 later when the funding comes through. That I just, I think for our I2D2 system in the beginning, that was super helpful. And then for this bigger C3 build, which is this real-time data system that we've been talking about, That's going to be really important for us to be able to sustain that. You know, we didn't tackle all 6 use cases at once, but really trying to make sure you leave yourself room to do those things if the opportunity arises, I think would be a good recommendation.
Perfect. Thank you. And Tiara, supporting and sustaining this work.
Yeah, so I think really to echo what Heather said about mission and visioning, I think having a true north to guide you in all your decision making is really important. For us, it's school readiness, and that has allowed us to stay kind of true to the work that we're doing, figure out when, no, this shouldn't go into Link B5, or yes, this absolutely does need to be a feature in Link B5. Having that true north has really helped to gather everybody when it comes to decision making. I also think having a combination of partners has been key to Virginia's success, namely having a higher ed partner. So we host our data system through the University of Virginia. So we own the system, we own the data, and we are the funder of everything. But being able to work with UVA in partnership has given us way more data analytic capacity. So that's part of how we can use the data so quickly, because we have analysts working as it comes in to make sure that it looks right. And it's also made procurement so much easier for us as a state agency. You know, we're not necessarily known for being really nimble in acquiring and building technology. So having that partnership has been super helpful. And then I think lastly, really having that in-house team to crunch the numbers has made our system really useful to many, many people. And that has really helped with sustaining it. Because when, you know, I'm asked a question in a meeting, we really can answer it with data, right? Like in that meeting. And so the more people see its utility and see how helpful it can be, the more people want to advocate for it, the more people want to put resources into it, and the more people want to ultimately use it as well. So I would say a true north, partners, and in-house data crunchers.
Excellent. Well, thank the 3 of you. We are now gonna shift to Q&A. So I think, so, right. So, okay. So this first question, Tira, I don't know if you see it directly, but just for folks in the room. So this is regarding Virginia Connects for Kids. What is the process for a 1-year-old child receiving from a family child care provider, like getting one of these IDs, getting a student ID? Like, what's the plan for how to connect that ID from that, in this case, a private provider, to the public school system?
That's a great question. So we do use some probabilistic matching, and we look retroactively once that ID gets assigned. So if you could imagine, let's say 3 years ago, we had an infant who was enrolled, and now they've gone through, you know, different iterations of early childhood. We use a combination of first and last name, date of birth, gender, and then we first try to just use probabilistic matching to see if in kindergarten or whenever that child was assigned an ID, the earliest you could get one in Virginia is technically birth if you're in mixed delivery, but typically we see it happen once a child enters public school. So either 3, 4, or 5 years old in kindergarten. So when that child gets registered for kindergarten and is assigned that ID, the system will look back and say, we see a kid that has, you know, the same first and last name, maybe 1 digit off for a birthday if there was a typo, and, you know, the same gender. And so the system will say, I'm, you know, 90% confident that this is the same kid. And so a person, we have human beings who also help with this, they will look into the queue, and there's a queue of missed matches. And then we will, you know, review administrative data and make a determination and say, yes, this is the same child. And so what we do is attach the ID in kindergarten to the last 5 years of their records, or the last 3 years of their records if they're a 3-year-old getting an ID for the first time. So there's definitely kind of a blind look in a way for current infant and toddlers, but as they mature through the system and as they grow up, we're able to retroactively link their ID. And in VA Connects, this is a lot more seamless and happens a lot more in an automated way, because people who are entering the children, they are able to they're able to say, you know, I know that this child used to be enrolled in this center, or this child was in my infant classroom last year and now they're in my toddler classroom. So I'm also confirming that these records should be connected.
Thank you, Tiara. Right, so our next question here. All these systems cost money and they need leadership support for sure. And this is just open to the group. Can any of you, all of you, talk to how like the journeys of these systems from like early days, early discussions to this end product, the built system? And I'll just open that up.
Well, I'd be happy to start. So I kind of mentioned earlier, our Childcare Connect system came out of recommendations from the governor's task force. So it was really leadership driven from day one. You know, it was the governor saying, put together a task force. The task force said, hey, we need to fix childcare. Here's some ideas for what we think would help support our childcare system. Now, the opportune moment was that also came at the point when there were federal recovery dollars designed to support childcare businesses. And so, you know, we were at the table as the university partner. There was money available to stand up something. Now, when those kinds of dollars are available, I would say that's when you capitalize on infrastructure building. You know, something that's going to take resources to build and then less resources to maintain. Anyway, that's how ours evolved. You know, it was kind of the right moment and the right time to invest infrastructure dollars to build something, and then now maintenance dollars is what we need to maintain the system, so it doesn't require nearly as much as it did to set it up.
We have a pretty similar story. We originally used PDG dollars to pilot the concept of Link B5. And the timing just worked out that we finished the pilot and it worked. And at the same time, more PDG dollars were available, and ARPA dollars had come in as well. So we were able to heavily scale in a pretty short period of time using those dollars. And now we're still in some building phases because we're still continuously adding different enhancements. And so because now the system is supporting a few different initiatives like our kindergarten readiness, our literacy work, our quality work, we're able to use those funding sources. So like our Literacy Act is funded with state general funds, and we're able to use some of that for our data system. And then, you know, we also use CCDF because it supports our quality work. And so having that kind of the diversity of programs that are within this system has also kind of naturally just diversified our funding sources as well.
Yeah, I will first state that this project started before I joined the organization, so I wasn't here in the early days. But I do want to echo what was said before. I think timing, obviously financial resources. This work began from PDG. The last thing that was really important to us was we had a pretty well-aligned infrastructure in the state. I already mentioned our state data warehouse, but in sort of having a lot of agencies submitting data to the same place, it was really easy to sort of cross-check what data was being collected by who, and being able to figure out what was needed to sort of determine eligibility across the program. So that infrastructure was really helpful in the early days as well.
Excellent. Thank you all. All right, so our next question, and I'll emphasize this is asked in a friendly way. We're here to learn today. Jennifer, I really appreciate the question. But like she's speaking to this, she's naming this concern around like quote unquote big brother, the implications of collecting what can be pretty sensitive data, you know, birth to grave, birth through, you know, entering the workforce, what have you. So like, do you have reactions to that? Like what are the goals of your states in collecting these data, building these data products?
I can start because we certainly have heard this, and it's definitely something that we have heavily grappled with. I think the first thing that we start with that's important to understand is that this data doesn't live together. So functionally, it really is a random series of numbers that is associated with data. And so, we don't have a first and a last name, and then every assessment, a child has ever done for their entire life in their high school data. We don't have all of that living aside names or any sort of PII. So we do partition our data. And the same is true at the state longitudinal data system. The only time any IDs are even brought in is when it is time to match to create a data set across, two state agencies or two initiatives. And so that really does keep the data pretty secure. And we have a few different infographics that we've used to really explain that and make that plain to providers who have had these concerns, to school divisions, to parents, and so on. The only people who can see PII in the system are the teachers in the classroom of those students. And so in VA Connects, when we, do these kindergarten readiness assessments and these literacy screeners, there's a parent report that comes out of the system. And the only people who can access that are the teachers who actually administered the assessment to those students. And so they're able to give something to parents and send that home or go over it in parent-teacher conferences. For them to understand the continuum of their child's educational experiences from birth up into kindergarten or first grade, or whatever point they're at. And so the parents get the benefit of that continuum while at the same time keeping their child's information safe. And the teachers get that benefit as well because they're able to know, this child in my class has not had any early childhood experience. Kindergarten is the first time that they're, sitting in a classroom and being asked to walk in a line. So the teacher can kind of cater that child's experience and use that information to really lead her instruction and her support in that child. So we really worked hard to design our system so that the biggest beneficiary of these of all the work that we're doing are parents and their students, and then very closely after the teachers.
So yeah, and I'll add to that, I think from a big picture response to that question, I would say, I go back to what I said earlier, which is have your vision and mission and clear discussions up front about why you're building the system. I think, yes, going into something with a kitchen sink approach of saying, I'm from Iowa, so I use this like, if you build it, they will come, right? Throw your data in and everyone will benefit, right? Don't do that. Definitely don't do that. Have your vision, have your mission, talk to your partners about why you're building it, what it will be used for, and come up with a governance plan. I mean, our system has a very clear, documented, signed, agreed upon governance approach. Here's how the data will be used. Here's who can use it. Here's who can't use it. Here's what it will be used for. Here's what it won't be used for. And here's all the things that you have to do in order to use it for certain purposes, which I heard Tiara saying very, very similarly, right? You have, it feels like a kitchen sink, but it's not. These are not kitchen sink things. They're very circumscribed purposes for which they can be used. And I think if you talk about that a lot up front and really come up with those use cases and how you're going to govern the data use, you can really address that. And I think, to the, question about families and how are people responding to this, again, I think it's about communication of that mission and vision and purpose. What is it for? What is it being used for? What are the limits on it? And that becomes really important.
Yeah, and I mentioned this earlier, but a big consideration for us was the data privacy piece and whether or not we would even see the data. And so that was something that we really intentionally decided the applications are going to the programs and not to us. The only data we really collect on our end is like whether or not applications are completed, when applications are being filled out, just from more of like a user implementation side. But that was, we wanted to be very clear about who was getting data and for what purposes. And so those were early conversations for us.
Thank you all. And Heather kind of spoke to this immediate like corollaries from Brian, but I don't know if Tira, you or Molly have like any additional response, like pushback from families or others, and if y'all have received it, like how have you and your colleagues tried to address that pushback?
I think for us, we really relied on our family council. So we fund a family council for each region, and we run a lot of things by them and talk to them about a lot of things and ask them, what do you want to know about this? What can we provide? What information can we set up for you? And then let us know what you think. And so we really relied on them when we started to collect student data in this system. And that was really where the emphasis on making sure that parents get a benefit from the system first and foremost, and more than anybody else came from.
Yeah, and I think as far as data collection, we became sort of experts in the application process and what data was being collected by other agencies and organizations for eligibility, to again sort of just make sure that we're not over collecting on data. We have a system that's pretty responsive. For instance, it will tell based off of where a person is in the state what services are available like locationally, and so just sort of being able to interact with the data that we're given as sort of a safeguard to make sure that we're not over collecting. And so for that, we haven't really experienced, at least to my knowledge, that much pushback on the application, the data application.
Yeah, and as Angela just mentioned in the chat, we welcome any questions in Q&A. But yeah, I have a few more questions of my own. So, earlier Tira mentioned they in Virginia, they welcome data reporting from private providers. It's certainly not required, but they welcome it. But like my question, I suppose geared to Heather and Molly, like how does this work in your state really accounted for those more informal or like unregulated providers, whether it's like um, childcare homes, FFN, what have you? Like, have y'all really made outreach to that population of providers? Like, how's it gone? Like, how have you incorporated data from what is like a pretty big slice of this early childcare pie?
Yeah, so I'm correct. I might be misunderstanding, but as far as like with early child care homes, we're really lucky in the fact that, or we're really fortunate in the fact that First Steps is sort of we basically oversee the operation of publicly funded programs in non-public spaces, and so we do have sort of those that network to maybe programs that would otherwise not necessarily be counted. But one of the things that we were very intentional about with the South Carolina First Five portal is we didn't want to overwhelm the system. And so we've kind of been onboarding programs in waves to help us identify usage and how to best outreach to certain programs that are needed in spaces. And so by sort of having these different cohorts of programs coming onto the system, that's helped us really being able to forecast long-term what's needed in the system, because as has been mentioned previously, things change on a day-to-day basis. And so that's been a really important component for us. But also then again, just leveraging that network of the work that we do outside of First Five.
No, I should have been clear. That's a perfect response, Molly. It's just like there is a swath of services delivered, often in homes, but like more informally, that may be license exempt or otherwise. But yeah, it can be tough for any of this like data work to really account for them. And so yeah, I appreciate that response, Heather. I don't know if you have one as well.
Yeah, I mean, not a ton to add other than, our Child Care Connect system. We tried to find as many data sources as possible. And so one of the partners is our CCR&R network that has their own contracted data system that includes, licensed, registered, and unregistered, a lot of homes, that serve very small numbers of children because they want, when families call CCR&R, they want to be able to show that there's a childcare provider available. So, we've tried to include as many of those as we can from the different data systems we have, but it would definitely recognize, there is a, not completely invisible, but a harder to find population of childcare providers out there for sure.
Absolutely. All right, so I see we have in Q&A a question here, and I suppose again addressed to Molly and Heather primarily, but can you speak to the process of translating the data, any analyses or analytics into policy impacts and perhaps like policy options, particularly like from a cross agency or like kind of cross services perspective. And like she names this example that Tira had brought up around like quarterly or annual facilitated data conversations. So like Molly, Heather, like how have y'all approached this, taking the data from collection through analysis to informing decision making?
Yeah, so the First Five portal is South Carolina First Steps is also, our board of trustees is also the Early Childhood Advisory Council in the state. And so the First Five portal is actually specifically an initiative under that Early Childhood Advisory Council, which means that when the board meets, they hear all of the information about how is the system being used, where, like, what programs are receiving the most referrals, when are we receiving applications, like what time of day. And so that, because that board is made up of the heads or director level of different agencies, all the different agencies in the state that work with early childhood education, that we are able to really share that message of the data component pretty widespread and at the same time. So that's been really lovely for us.
Yeah, that's a great question. I'm talking about two systems here because I know primarily we're talking about C3, and this is something that has been such a new system that, we rolled it out last August. So it's really, kind of in its infancy stages. But we use a similar process as Tiara mentioned. we have work groups that come together. A lot of times our state partners initiate that and, hey, we want to make this. Right now we're talking about version 2.0 for C3 because, you build something and then you're like, oh, here's all the things we wish we would have done. And so we're thinking about how we're going to advance the next steps. And so we're having conversations from those analytics to say, well, here's what we're learning about trends in vacancy and supply and demand over time. So how do we want to address this? Or how are people actually using the data in local decision making and trying to come up with some case studies of how it's being used. And so, we try to use those cross-system work groups as much as possible. In the other work of I2D2, that's a little bit more, I would say it's maybe a school age or in an integrated data system lifespan. We actually have quarterly meetings that are routinely scheduled. We also have processes to put out news, policy briefs and newsletters of work that's coming out on a regular basis. And so we've generated a whole communication strategy around that we have state and local partners tell us the most valuable information coming from the larger longitudinal, research and analytic work. And then we turn that into things that go out more regularly. So we kind of do a little bit of both, but we're trying to build a little more of that in with C3 now.
All right, so I see another question really focused on a key facet of this broader system. So referrals to services. So, like, to what extent did these systems, these products, capture data on referrals? Like, how did these again, systems or products, support referral specialists and support this process. Like, do they have access to integrated data? Are there tools that are created to support, this specific population of data users?
I can answer quickly in this one because we don't do that yet. So with C3, the data are available at the aggregate level. You can see providers that have vacancies, but then the explicit instructions are go work with your CCR&R director or call the program directly. So we don't make, individual data or any of that available on an individual level. We get just close enough that folks can find what they need and then point them to the exact person. Now, as I mentioned earlier, when we designed our use cases to think about future states of things, that is something we want to talk about. Is that possible in a legal and ethical way and that protects privacy and does all the things? But right now we don't do that directly with C3.
And Virginia is the same. So we don't do that in Link B5. We are able to provide aggregate data to partners who are supporting this work. So we can do things like, look at how many sites in a county have an ECSE endorsed teacher on staff, how many ECSE classrooms a particular area has, things like that. But in terms of handling the referrals, we don't do that.
Yeah, the same, aside from like the application referral from eligibility, we don't have any sort of specialist at the moment. I think wish list down the line, we would love to have something, especially sort of as Heather's talking about with like availability, we would love to include that component in some capacity, but it's just not possible with the system at the moment.
Well, so we more or less have time for a final question, and like y'all have just mentioned, like, what do we wish we could have? Like, what would be, kind of the ideal next step? So I guess my question for our panelists, like, what are next steps? Like, what are y'all working towards with these systems and products? And what's like the future look like over the next year or so? And I ask that, I'll qualify it just given the state of the world and the dynamics that affect these conversations and systems. But I'm just like curious what comes next for each of you in this work.
Yeah, I can go first because this is a small thing, but something that we're very excited about. One of the questions or areas that we've sort of been grappling with is communication with families that start but do not finish an application because everyone has very full inboxes. I know I don't answer phone calls from numbers I don't recognize, and so we are piloting texting our families about applications and follow up that way. And so we're really excited about meeting people where they're at in a communication form that we think most individuals prefer to use. So that's something that we're really excited about.
And for us, we focused a lot on child slot vacancies. And what we quickly realized was, and we kind of knew this going in, but we hear a lot about it now more, providers saying to us, well, no, I don't have any openings because I don't have enough staff to fill more slots. So now we're having conversations about, okay, where's all the staffing data and how can we include that so we can really understand the challenge with our childcare providers of trying to provide as many slots as they can. Because we all know, for those of us in the childcare field, license capacity does not mean operational capacity of a program. They might have a lot more square footage, but they only have 3 teachers. And so that's their capacity. So we're having a lot of discussions about that and how we can, how do you capture staff openings that are actively recruiting versus, well, yeah, I have a classroom upstairs that I could use, but I'm not really intending to use it right now. So we're thinking about that as a next phase.
For us, VA Connects is kind of our next big thing, and we'll fully launch that in August. And so I think our big next step is going to be reporting for teachers. So doing focus groups around the state and just doing a ton of intentional outreach to find out like what do you as a kindergarten teacher want to know about, the last 5 years of your students and what would be helpful. What would be helpful for principals and administrators and dean of students, positions like that. And then also for, childcare educators as well. What, as a preschool teacher, do you need to know about that child's toddler or infant experience? Is it just that, they had one? Do you only need to know that maybe this is their first time coming to a childcare center? Do you want to know that previously they were in a family day home and now they're transitioning? Do kindergarten teachers want to know that? Do first grade teachers want to know that? And once we kind of understand what would be helpful, then working to build out some of those reports. They tend to be one of the more expensive features, those custom build reports. So we want to make sure that we're intentional and that we're being good stewards of resources before we embark on a really long journey of getting the data to be usable and very specifically at the fingertips of educators.
Well, perfect. I thank our audience today for the questions, but thank you to our three panelists for taking the time, for being so candid, open, and thorough in their responses today. And as I mentioned at the top, we at DQC so appreciative of the work they do and their partnership in this work, and really our hopes broadly in this space. We hope to support other states, South Carolina, Iowa, Virginia, doing great things. They'll continue to, but there's great potential across essentially every state to do similar things. So how can we, work together to raise awareness, interest, and hopefully spur investment in this early childhood data work? So with that, just want to thank everyone again, and we'll hand it back off to Angela.
Thanks, Charlie. Thank you, everyone, for this really informative session. I really appreciate the panelists sharing their insight and time, and the partnership with DQC has been really great. So hopefully everyone in attendance heard or saw something and was like, yes, I would love to do that in my state, and show me how. So since we've been talking about data, we want to collect a little bit from you now. We are going to launch a quick poll to gather some information from you, just a quick evaluation to kind of get your thoughts and see how we are meeting your needs as the Hunt Institute and providing these virtual convenings for these learning communities here. So the poll should have just popped up on your screen there. And there are 7 questions. Don't overthink it. Just give some quick feedback here, and that'll be helpful for us. And I'm going to just hold space for about 2 minutes to give y'all a chance to do that. All right, we got through that. Awkward silence. I'm going to leave the poll up for just another minute while I talk to give these last holdouts here a couple of minutes to respond there. So just thanks again so much to Charlie, Camila, Molly, Heather, Tiara. Really appreciate y'all's time here. This recording, as Kelly said, will be shared with everyone who registered, along with the links that were shared in the chat box. Any other resources that would be helpful so that y'all can kind of dig more into these examples and get in touch with these organizations if you would like more information. You can find out what other webinars are upcoming at the Hunt Institute by going to our website. It's hunt-institute.org. Click on resources and then webinars, and you can see what's coming up for early learning, as well as all of our other content teams, our K-12, higher ed, and educator diversity. So please take a look at that. And in the meantime, we'll give you a little bit of time back in your day to get a little stretch break, maybe get some sunshine if it's sunny in your area. And we will close things out for now. Thanks again, everyone. Have a great rest of your day. We'll see you soon. Bye-bye.